Hello, everyone, and welcome to the first webinar organized by Neurum Health. I'm your moderator today. I'm Adrian Buffington Wong. I'm leading marketing and communications at Neurum Health, and we're so happy to have you today. Before we officially kickstart, I would like to share some housekeeping rules for our participants. So first of all, please mute yourself during the panel discussion. And if you have any questions, please feel free to type it in the chat box. We'll address that towards the end of this webinar. This panel discussion is being recorded and will be made available online. So now, without further ado, I'll get into the webinar. So thank you very much for joining the New Thoughts webinar series organized by Neurum Health. For those who are new to the Neurum community, we are a digital mental health company aiming to close the gap between mental health care needs and available care. When it comes to corporate well-being, people often associate it with staff wellness and also physical wellness. But what is more important and what we are going to address today is minding our community's mental health. And joining us today, we have three domain experts. So the first one we have Gilbert. Gilbert is the co-chair and founding director at B Lab Hong Kong and Macau. Being part of the global B Lab network originated in 2006, B Lab Hong Kong and Macau was founded in 2020 and have been promoting the movement of businesses as a force of good through B Corporation certifications. Secondly, we have Fabrice. Fabrice is the Strategy and Impact Director at Palo IT. Palo IT is a global innovation consultancy and agile software development company. With tech as a good force for good in mind, Palo IT is the first Hong Kong tech company to earn B Corp status. Fabrice focuses on designing and implementing innovative, profitable, and sustainable policies. He also believes that sustainability is one of the major topics to deal with for the coming decades. Finally, we have Marie-Charlotte. Marie-Charlotte is Sustainability and Transparency Senior Specialist at the Definite Group. The Definite Group has been a B company since 2019. The company offers a new model of beauty for good, a responsible beauty capable of generating a positive social and environment impact. Marie-Charlotte got into the domain of corporate social responsibility because of her personal pain point in her hometown. And since joining Definite, Marie-Charlotte has been coordinating the B Corp certification process and working to maximize the company's transparency towards external stakeholders. So today's agenda will be focusing on, keys to build business for goods. What does community really mean to B Corp? And also we will discover why the business sectors and how the business sectors can invest more to emphasize mental health for their community. So without further ado, I will start the panel discussion with a question of what does mental health mean in your organization? So if Marie, you will start sharing your thoughts.
Sorry, I had a small glare. Can you repeat the question?
So the first question is, what does mental health mean in your organization?
Okay. In our case, I think mental health means a lot of different things. Like the first thing I would say is what comes to the top of my mind is balance. So the balance between the personal and professional life. This is something that we are working very hard on. And the fact to guarantee that people could, respect themselves by having a good life, which in our case, more and more, we are realizing it's not only working, but it's also living the best life that you can. So yeah, what's the balance?
Thank you. Fabrice, do you have anything to add?
Yes, sure. First of all, I want to thank you, Adrian, and the whole Neuromers team for this opportunity to talk about mental health and business, both of this topic. Because one, if it's a topic I am interested in, but also I think this is really important for companies to address that topic. So thanks for that. So what does mental health mean in my organization? First of all, I have to confess something. I am a really and strongly business-oriented guy. So actually, you might ask, how can you both think about profit and people environment at the same time? But that's my job, actually, at Palo IT. I am trying to conciliate business and sustainability. And I'd like to tell you like a short story. It was the first time I met Palo IT's founder. We debated about implementing sustainability within Palo IT business model in order to add value to the company. It was the first topic addressed by the founder. So we talked about the fact that today more than, let's say, 80% of workers face some form of burnout, or at least mental health issue. And almost 70% of them said their daily work has been interrupted by these challenges. So actually, if companies don't care about mental health problem, they will face to a problem of productivity of their workers. So that was the beginning of my relation with Palo IT. And the idea when I joined the company was that I wanted Palo IT to outperform their peers, its peers, meaning that we must cultivate like a sense of empathy, of flexibility, help to develop new skills to address new needs, and let's say having an holistic approach regarding mental health to support our employees. And one of our best value at Palo IT, it's actually one of our key result, objective key result, it's to reach 90% of employee satisfaction. So that means that we really take care of the well-being of our employees. And we are trying to implement a good HR policy, but this is not only about HR actually. This is for the whole operation of Palo IT. And we achieved this goal last year because we reached 99% of satisfaction, globally speaking, not only in Hong Kong, because Palo IT is a global company, as you said it previously, Adrian. So we are proud of that. I don't know if I have enough time to give you some example now, or if I keep them later, just tell me.
Please go ahead.
Okay, sure. I will need 2 hours, sorry for that. Okay, so feel free to interrupt. It's totally okay for me. Let's say that first of all, Palo IT, when I talk about HR policy, Palo IT focus, let's say, to regularly follow its employee. And it's not only by interviewing them, it's also about, let's say, implement a 360 process to ensure that they are feeling good in their job and more generally in their life. So we are asking to everybody within the company what is his opinion, his feeling regarding the work, but also the state of mind of each employee. And it's really important to have this feedback from everybody. But that's not the only thing, of course. We also really take care about people, and we foster them to say when they are not feeling well. Or they are tired, or they are having trouble in their personal life. We try to accompany and to support them in every kind of their daily life, let's say. And that type of feedback for us is critical because monitoring that in this way will help the managers of Palo IT to pinpoint any particular hotspots in the business and let's say find some solutions to address or to implement to improve that pinpoints. So it's really important to have that. And we also follow weak signals, because sometimes, you know, you have some increases of conflicts, or you have more customer service complaints, or you have an increasing number of sick people, or you can also have missed deadlines in production. or you can have a lot of people leaving the company at the same time. These are weak signals we have to take care of if we want to be sure that there is no problem regarding, let's say, the general behavior and the general well-being of our employee. And again, as Marie-Charlotte say, and I totally agree with that, we as Palo IT are pretty convinced that the less constraints the worker has in his life, the better he will give it to the company. So the best productive he will be. And so we really pay attention that all people feel good when they work for Palo IT. I can stop it here, and I can give you more example later.
let me stop you here first, and we'll revisit this topic in a bit. Gilbert, in B Lab Hong Kong and Macau, what does mental health mean?
Yeah, I mean, thank you very much. I think, yeah, from our point of view, as Fabrice has said, before all the companies put all the emphasis on the profit, on the business, but now the new trend is trying to pursue a triple bottom line, which means profit, the planet, and also the people. So the people is more around the mental health, because apart from physical health, as Fabrice has mentioned, mental health is also important. So for in B Lab, we are promoting B Corp. The B in B Corp means the benefits for all. That means as a business, apart from making profits, we also want to create a positive impact to all the stakeholders apart from the shareholders. For us, the mental health of our people, not just on the employees, still the workers are important, but for us, we also try to measure how the company create impact to the customers on the one hand, but also on all the communities that we serve, maybe all the people in the society and all the, also our suppliers. Okay, so this is how we try to do. In B Lab, we trying to use a certification. So as I said, we are promoting a certification system. We try to measure how much a business create impact to 5 key stakeholders: the governance, which is among how they protect the interests of the shareholder, the workers, the customers, the environment, and also the communities. So that means we are trying to just go beyond the CSR, the corporate social responsibility. We're trying to argue that this is something that we can do good business well, meaning that they can use their core business to create not just the profits and also the benefits to the stakeholders as well.
Well, thank you. I think one of the points you try that is very insightful is that companies are trying to balance different stakeholders' benefit, and we'll dive into that in a bit. So this webinar is titled "Minding Our Community's Mental Health." So when it comes to community, it is not about individuals, but the collective benefits. So if we can focus a little bit more on the commercial benefits of it, why is the business sector putting more emphasis on their people now instead of a couple of years ago, or why is it now, and why is the business sector doing more? Can I pass this time to Marie-Charlotte?
Sure, thank Adrian. So I think this increasing focus is due to the fact that businesses are having a growing awareness of how it is important to bring this kind of value and into the business world. By this, I mean that we are now realizing how important it is for the new generation that are coming into the work environment to have certain guarantees. So having a focus on well-being is a really good way to attract talents, but also retain them. And what we have been observing also is for sure a better well-being, so a better welfare in the company is also driving to more motivation in the work environment, to more creativity, because people are tending more to explore different paths that if they were just, you know, working every day without having the time to really also explore their own growth, they wouldn't think about. And what I would say is also it's bringing increasing proactivity, because when people are happy, they want, you know, they want to do things differently. They want to explore different paths. They want to challenge themselves. So I think it's, in a way, for sure, we're all doing that because we're all human beings. It's in our interest to, I think, make people happy. But in a way, it's also a very pragmatic approach, in a way that if I want my business to go well, well-being is for sure, well-being and health, let's say, well-being is very important to maintain my business in a healthy state. So I would say it's both pragmatic and both very much into the value. And I'm saying this from the point of view of a company that have been working on sustainability from 2006, and that have been focusing more at the beginning on the environmental sustainability. And we have been increasingly understanding how it is important to work on the social aspects, because people are the driver for everything. So you can invest how much you want in the environment, but if you don't have people on board, you're not going to change things. So yeah, I would say that it's both very pragmatic and coming from the heart.
Right.
Yeah. Sorry, can I add one point?
Absolutely.
Yeah, thank you, Adrian. Yeah, I think what Marie-Charlotte mentioned is very true, especially after COVID, because I think COVID has changed all the things around the workplace. I think how people interact, how people, you know, interact with their customers regarding where they work, and also how they work for the company. So I think, and also the COVID also making the mental stress hugely, serious. I think we have to take care of the mental health of our people so that they can take care of these, challenges around the world in a good shape.
Thank you, Marie-Charlotte and Gilbert. Fabrice, as a tech company, how do you see tech company contributing to, facilitating better mental health in our community?
There are a lot of different ways to approach to answer to that question. I think digital is everywhere today, and digital innovation can help people, for example, to meet each other, to be connected, to stay connected to a community. So first, it's very important. Secondly, if we talk about health, for example, you can meet doctors online now, so it's easier for people that are living far away from the city center. It's easier for them to have this appointment with someone else. So digital is everywhere. And then the last thing is that datas are let's say also really important, because with datas, if they are well used, I can say, they can provide you some, let's say, some decision making that allows you to manage, to handle the problem within your company. For example, if like I said, we are following our workers with a 360 framework, and each time someone is answering to a question, we have let's say like a score that is corresponding to the answer, and then with this score we visualize in the dashboard the different things that where the worker is not feeling good, and identifying that allows us to work with him on a very precise topic. So I think this is really important. And I think also, of course, Neurum is a very good example of a tool you can use to monitor the mental health of your workers. And I'm proud to say that, because as you know, we are Adrian, we are partner of Neurum for the development of their application. Now with the new version of Neurum, it's very easy to people to follow their progress in their mental health pathway, in their mental health journey. They know that they have a problem, they work on it, and then they have access to that data saying, yes, I improve my mental health in that topic. In this one, perhaps I have to go a little bit further so I can work strongly on this one. So identifying that allow you to be very accurate when you work with someone who is not feeling good.
Thank you, Fabrice. I think one of the good example to illustrate how technology is, facilitating mental health is that everything can be done digitally and it's private. And one thing that the fact that we're doing this webinar, and Marie-Charlotte is actually based in Italy, and we are doing it live here. Really, the technology really enables us to, overcome that geographic boundaries and also time limitations. So yeah, if you think about that, the opportunities is limitless.
Sure.
Since we touch on the fact that Marie-Charlotte is based in Italy, from your observation, is there any key differences that you can share with us between how people see or companies see mental health in the West or in the East?
So indeed, Adrian, thank you so much for this question, which is really interesting. As a multinational company, we have to work with both the East and the West. We have people working in America, people working in Hong Kong, in China in general, but also we have distributors all around the world. So, you have Vietnam, Japan, and also we're going to have people from North Europe, South Europe, but also Eastern Europe, Russia, etc. And as you can imagine, the world culture around mental health is so different. But for sure, I would say that the biggest difference probably will be between the East and the West, which is in a way pretty curious because I think in a way, the East have been very well known for decades about how, you have been taking care of your inner self, all the thing about meditation and etc. But curiously in the modern society, it's kind of like people forgot this. And what I'm seeing now is mainly between my colleague from East and the West, people in the West are now refocusing very much from already a couple of years on how can I, make myself feel better? How can I grow personally, but also as a human being? Well, I see my colleague from the East really, working long hours, working almost 7 hours, 7 days on 7, 24 hours. And so they are amazingly available, which is amazing when you're working on different time zone, and which is very useful. But at the same time, it's not healthy. It's not healthy. And this is one of the reasons why we decided, in fact, to implement in our Hong Kong subsidiary, the Neurum Health app, because we thought it was very important to give themselves opportunity to check daily how they were feeling, to have access also to daily exercise about mental health, etc. And this is actually part of a program that we're doing globally as a company. In fact, as a company, we're making sure that in every country where we are based with a subsidiary or with, let's say, a physical company, we are making sure that every employees have access to this kind of app and this kind of, let's say, service tool that can help them to feel better. So yeah, I would say that curiously people in the East are now need to go back to their roots, which is a lot about meditation and taking care of themselves. And I hope that the work that we're doing with you is going to help us with that. And long term, our goal is also to bring this app also to our customers. So trying to really change also our market and our industry, which is the beauty industry.
If I may, Adrian, just to complete what Marie-Charlotte said, I'm here in Hong Kong for 1 year now, so I have some previous experience in Europe, and I can definitively tell you that let's say it's common in Europe to visit a psychologist. It's not anymore a problem to have some mental health problems. It's not considered, let's say, as a weakness, not anymore. Here, to be honest, it's still a little bit complicated, perhaps because in Asia, to accept the fact and even more to talk about the fact that you are not feeling well, you need help, you could be considered as different comparing with your colleagues. So it could be a weakness here. It's still like that. It's changing, but we are still stuck on that position. But it's changing, of course, and I hope it will be quicker and quicker. But I think our real challenge in Hong Kong and in Asia is to convince leaders that they have to treat mental health issues. I can say, like an organizational priority in their company. It should not be just relegated to HR problems or to HR team. It's everywhere. And let's say that leaders can serve as allies, if I can say that, sharing their own personal experience, their own problems, their own mental health issue, with this transparency and open-minded approach. I think this is really important to change all the mindsets of all the teams, beginning by the top management.
Fabrice, you brought up a very important issue, is that stigma around mental health still exists. If I can, pick your brain on this, Gilbert, what can businesses do more in terms of destigmatizing mental health in modern days?
Yeah, I think as I said, I think Peter used a certification to encourage the business to foster and also take care of the mental health. And what we're trying to do, we use the tool that we are using is what we call the B impact assessment. So we use this tool to measure or to assess how a company take care of the mental health. And what this assessment is different is we try to measure how the mental health in all the different levels. One is how they take care of the mental health in a more remedial level, meaning that whether they have any insurance policy to cover a mental illness. Okay, this is on the bottom level. And the second level is a preventive, whether the company has any program or policy in place to prevent mental stress. For example, whether they offer any wellness program to the staff, whether they have any family-friendly policies, because the mental health or mental stress sometimes also coming from the how you relate to your family, to other part of your community. Okay. Thirdly, we also measure how the company foster the mental health on a more developmental level, meaning that how the company engage the staff. For example, making policies, making more engage them in more activities of the business, so that the customers, the employees would feel more motivated and more engaged, or feel a better bonding with the companies. Then also in a way make them more resilient towards the challenges they would face. So we try to measure the mental health, or try to measure how the company foster the mental health in all the levels.
Thank you, Gilbert. So there are two parts of this conversation. So one is how we can enable mental health for our communities, but also we want to focus on B corporations, like how it enables us to do more about mental health. So Gilbert, you are the expert in accreditation for B corporations. What does mental health mean for B Corp specifically? And when it comes to the accreditation process, how important it is for companies to showcase their mental health capability? Okay,
I think there may be 2 points. One is, I think we take care of the mental health. We encourage the companies to take care of the mental health of all the people, all the stakeholders, the workers, the customers, and also the community at large. So this is one thing that we try to encourage. So they get a better chance of getting certification if they take care of all these stakeholders. This is one. Secondly, we also try to, the B impact assessment also measure how the companies create positive impact to the mental health on both directions. One is the operational impact, meaning that how the company is managed or operate on a daily basis that would foster the mental health. Okay, for example, whether they provide the financial security to the staff, whether they create a safe environment to them, whether they have a good policy, good insurance policy to them. This is more on day-to-day operation. Okay, but on the other hand, we also have a section to measure the impact business model, meaning that how the company specifically design their product, their business model to create positive impact on mental health, specifically to certain target group. Okay, so for example, they can develop a product, providing good mental health to the end users in the society. For example, a wellness program, wellness software. Okay, this is one thing. Secondly, they can also design a product or a service that they can offer a job opportunity to the mentally challenged population. For example, ADHD. Some companies develop a service, train up the ADHD people, and then build on their strength. In fact, because the ADHD people sometimes used to be quite energetic, so they can use their high energy personal quality to be a excellent master of ceremony on some occasions. So this is how we trying to measure the creative, the positive impact, especially relating to mental health.
Thank you, Gilbert. That's very clear. When it comes to mental health, this initiative is not completely new, but to a lot of companies, they're still getting there. And during the process, when companies are investing or getting more efforts, putting more efforts in mental health, there is a new term emerged recently. It's called well washing. So instead of going into details about how companies are doing things in a way that they're not doing it genuinely, I would like to turn it into a more positive note, as in Palo IT and Definus, you two companies have been doing mental health very well. What is in the process that you make sure everyone is aware of the benefits of the mental health policy, and how do you ensure that people are not, as in, for example, managers or even senior management, they're not using this as an opportunity to market a company? Perhaps Fabrice, do you want to take this first?
Yeah, it's not an easy question, actually. And I will say again that probably all starts with listening. If you listen, you can detect the weak signals. It's not easy because sometimes for example, when you arrive at your office in the morning, you always ask to everybody, how do you feel today? And the unique response will be, yes, I'm good. Yeah, okay, but concretely, is it true? Is it false? We don't really know. So it's not only about that. It's really focusing on their daily work. Is there something that is changing? If yes, it could be a signal. We are ready to take care, and we really foster and train our managers to detect such changes. After that, for example, within Palo IT, we have now a chief of staff in every subsidiary, meaning that this is a staff people dedicated to the well-being, but also of course other things, but mainly the well-being of people. And since we have this person within Palo IT, we implemented a lot of initiatives. And for example, and to bound what Gilbert said just previously, we try to improve the well-being of our workers, proposing to them, for example, I don't know, we have reimbursement for sport equipment or hiking products. We have also, when they have to travel for personal reason, at the moment of the COVID, we reimbursed the quarantine hotel. When they are sick about COVID, we give them a care kit. We have also messages, we have yoga lessons in the office. We organize team building events very frequently. Every month, we have several team building events. And lastly, I can say also we encourage people that find it more convenient to work remotely. So we are always working on the employee's way. And so each worker trusts us. And I think if you are able to build this trust, people is more transparent with you and is able to give you his real feeling and his real opinion about what is achieving or what he's doing. That's really important to build this trust again from the top management, but also with the middle managers.
Thank you, Fabrice. I think if I could just summarize it, I think persistence and regularity really shows that whether a company is committed into investing in employees' mental health. Marie-Charlotte, what's the practice in the Definite group?
Yeah, I think we are beginning to get exposed to washing. We had like this greenwashing, this DG washing, and now we have the well-being washing. When we start to communicate something, when we want to communicate about something, it's there that normally things start to get, let's say, challenging, because you want to say something about what you're doing, and sometimes it's there that the trouble are starting. So in Deviness, what we try to do to avoid doing well washing, starting from what Fabrice was saying, also trust is very important to build things that are, on a regular basis. But I will add also to this the fact that it's always necessary to be very humble on what you're doing, not try to maximize what you're saying, with really good words that sounds really good, but at the end are not exactly, are maybe making things a bit bigger. And I will say also be very practical. When we are implementing actions in the well-being sphere, we're always trying to, propose things that are very practical and that are also, that we can measure. So we are going to implement an action, and after we are going to measure the positive outcome of this action. So I can give you a couple of examples of things that we implemented, such as, for example, we have, so obviously the Neurum Health here in Hong Kong, but we implemented also in other countries app or let's say software that are very comparable and for which we retrieve like, data analysis that we can make that obviously are anonymous, but that can help us, to understand if the actions that we're implementing are actually making things better, or if things are, stable, and we need to try to find other ways to maybe stimulate people and maybe guarantee that they are going to, live well and feel good. Sorry. And we also have obviously the implementation of unlimited smart working, which sounds super, let's say low profile, but we started doing that before the pandemic. And this was for us a really good guarantee for people, because we realized that we had so much less stress compared to other companies in the transition, because people were already used to it. It was not unlimited at this time, but still we had all the equipment, people were trained for working from home, and they were able to really, handle things a bit better. But still, I think it was Fabrice saying this, no, it was Gilbert before. COVID had been something that really hit all company very hard. And for sure, we realized that giving a lot of benefits was good. People were feeling good, but at the same time, the social distancing, the stress of being, closed down in a little room the whole day working, and after taking care of the kids, or even your, spending time with your partners, always, always maybe the two of you, or maybe the 4 or 5 of you, I don't know, depending on the family, could be very stressful. And this is one of the reasons why we implemented a couple of also psychological tools to help people, get better and maybe have a psychological following. But again, this was followed up also by KPI that we measure to ensure that this action actually a true impact, and that we could communicate about it, because we didn't want to communicate about something that we knew had 0 impact. So yeah, I would say being humble, measure when you implement very practical actions, and always make sure that what you're doing is very much measurable, so you can report about it, and you can implement improvement actions.
Yeah. Can I
Thank
add
you,
one point?
Absolutely.
Yeah. Okay, I think just to summarize, I think both Palo ID and Definitely, they have great practices. Like many businesses, they have great practices on fostering mental health. So from B-Lab point of view, we also try to make sure those practices, more sustainable and not more so, try to avoid the well washing. So that means we try to set high and holistic standards across the mental health. Okay, so there are 4 levels. One is where they have practices like, what Palo ID and Definitely Group have in place. This is one, where they have the practice. Secondly, whether they have a clear policies, and also the policy are clearly communicated to their staff. Okay, this is second. And then the output. So how many, for example, if your company has a very good, wellness program, how much of their staff have used the program? Whether the program is available to all the staff or only part of the staff, the output. But last but not least is the outcome. I think like Fabrice, they measure how their staff satisfied with their policies. I mean, this is hugely important, because maybe you have a great, you think we have a great practice in place, but whether your staff feel good is also important. So the outcome is also a very important thing that we at B-Lab try to measure, whether the company is really creating impact to the staff and also other people and also the community.
Thank you, Gilbert.
If I can add just the last thing, Adrian.
Yeah.
Okay, great, thank you. By chance, Palo IT currently is a fast-growing company. So that's good, of course, in a pure business point of view for me. But on the other side, we have to recruit a lot. And I can strongly tell you that the new generation, the Generation Z, prefers to work with a value-driven company. If you are not able to propose that kind of company to the new generation, you will not be able to hire people. And who are the best sponsors for you to recommend the company? These are your workers. So if your workers trust you and know that you are not only doing well washing, you are really take care of your employees, they will recommend your company to their relationships, and you will be able to hire new people. That's really important, because we are facing that now. And again, by chance, Palo IT is well known for all what we achieved and all what we are trying to implement to improve the well-being of our employees, and that works definitely.
Thank you, Fabrice. I think very, very accurate point is that different generations expect different things from their employers and also their communities as well. And especially Generation Z is not, I'm not trying to generalize the entire generation or different generations, but mental health is very important. And I think employers do have the responsibility to take care of their stakeholders. So, I mean, employees is just one of the stakeholders, and there are a lot of different aspects that they can take care of. Since we touch on, reporting and during that accreditation process, how to measure outcomes, is there any challenges when it comes to carrying out, implementing a mental health policy? Marie-Charlotte?
Yeah, I would say one of the first things that comes to the top of my mind is that sometimes things are not measurable. So for example, one big thing that we have been working on is happiness. We have a happiness officer here in Devoness, and we have been sponsor of the happiness report since 2 years, if I remember correctly. And one big question that I've been turning in worldwide is, how do I measure happiness? So you have like the approach of the happiness report, which identify a couple of KPIs. But if you listen, for example, to another country that have been very well known for happiness with last year, which is Bhutan, Bhutan has a different way of measuring happiness. So what is the right one? You have only one way, you have different ways. And sometimes, for example, when you implement a program, you are going to measure, the number of people that participated. And after, as Fabrice was saying before, maybe one of the outputs that you're going to measure is how people afterwards answer to the daily questionnaire. Are they happier? Do they feel better? But still, you won't be able to measure everything. Like, what is the mental state of this person? Is this person really feeling better, or is it only, a shadow that is going to be maintained for a short amount of time, and after it's going to disappear because it has not been consolidated? So yeah, happiness is for now something that we're still studying and trying to figure out how to measure it, but we don't have a recipe.
Right. So, really putting the numbers to some intangible things would be quite difficult. Is there any particular challenge when it comes to measuring or reporting in Palo IT, Fabrice?
Actually, I have the same issue as Marie-Charlotte, because when you propose the same questionnaire, the same inquiry to your employees each week, demanding them that what is your percentage of happiness? Okay, what is happiness? And week after week, the answers are always the same, because they are just seeking a square and that's it. So how do you prevent that? It's not easy. It's really not easy. And actually, we are reviewing this process. We canceled the previous, the current assessment we were doing within the company. And we are trying to figure out a new KPI, a new way to ask people their true feeling about their mental health. Not easy. This is the big challenge. And again, the second one could be, okay, so I have identified a problem with one of my employees. What can I do concretely? Okay, because I am only its company. I am only its employer. I am not a doctor. I am not a counselor. So I can advise him to make something, but I don't have the right to go too far. So what is my concrete action that could help me, that could help him or her? That's my point today.
Interesting, although in B Lab, in the being the assessment, we didn't have any measurement on happiness, but what we are trying to encourage is something, more bottom up, meaning that we also encourage the companies to ask their employees, to ask their staff to list out what should be measured. Okay, so if there are some policies or some measurement that are bottom up, they are generated by their staff. I mean, that could be also meaning that the company also take care of their staff more, try to more engage with them. This is what B Lab or B Corp is trying to encourage.
Thank you all. Before I ask the last question to our panelists, I will encourage our participants to submit questions if you have any to our panelists today. So my last question to our panel of experts today is, when you consider carrying out a mental health policy or a tool, what are your most important considerations? Perhaps Marie-Charlotte first?
Yeah, so obviously the thoughts are going to be many, but I think one very important thing for us is going to be, is this policy inclusive? Is this policy going to address like a problem that most of the people are going to, face? And when I am reading this policy, do I feel included in this? So this is very challenging because obviously some issues are still, concerning certain populations. I'm thinking, for example, about maternity leave. Most of the time we think about the mother, even if we are trying more and more to think about not the mother, but trying to follow BLAB lead on that. So the first caregiver and the second caregiver without mentioning the sex, the gender. But afterward, you always have like certain problems or issues, I will say, that are more of concern of certain population than others. But what we're trying to do is every time that when we're going to create this kind of policy, try to be as inclusive as possible when at least writing the text, and making sure that we're going to consult people to have a 360 degrees vision when we're going to put together the policy.
Thank you, Marie-Charlotte. Fabrice, what about Palo IT? What are the key considerations when it comes to mental health policies?
I think perhaps we must be proactive, and we must know how to adapt quickly, because changes are really quick. For changes, you can detect one problem within your team, and if you don't act very quickly, perhaps in the future you will not be able to tackle that challenging anymore. So yes, we have to adapt the organization. We have to adapt the processes of the company to answer to that new problem, new in quotes, because again, it's also for the well-being of the company. I think this is definitively that I will focus on the future. Again, because I think also regulation is arriving, even on that topic, and probably in the next coming years, each company will have to justify his actions, his roadmap about workers and about the taking care of their workers. So we will have to justify by numbers, by results, and by projects. And B Corp is proposing like such a framework to help companies to achieve that. So that's why I really advise companies to have a look on the B Corp assessment, because it gives tips to act. And yes, I think you will be able to adapt quickly in the future if you use that kind of framework.
Yes, very much, very much. I think what I'm trying to say is, I think considering mental health, not just a cost, but also an investment. In particular, if you have good ideas on taking care of mental health, try to make it as a commercial product, offering to the communities, offering to your customers, and also offering to society at large. That would make your business better, and also the benefits to the entire society and the world is also much better.
Yeah, if you could add something to what Gilbert was just saying, just think about the cost of turnover of people in a company.
Yeah.
It costs a lot of money to company each year. If you're able to retain people, making them happy, think about the added value that this is going to bring to your business.
Yeah, absolutely, absolutely. Yeah. The cost to recruit people, to retain people, develop people, they're huge costs to the company as well.
Right. Thank you very much for your input today. I hope that our participants will find this very, very useful. And there are a lot of research and white paper, finding out that mental health is important to bolster a company's bottom line and to protect employees' mental health and overall well-being. So if you would like to learn more about how you can support your community's mental health, please feel free to reach out to Neurum Health. And here, I would like to thank our panelists for contributing to this valuable and meaningful conversation. Thank you very much.
Thank you.
Thanks to you. Thanks to
Thank
you.
you.
Bye-bye.
Bye-bye.
Have a good day.